Alright, so we're going to talk about extubation today. So, just like any procedure that we do in the hospital, we have to make sure that we have the doctor's order. So, basically the doctor and yourself included as the RT are going to evaluate the patient and decide if this person is ready to start weaning off the ventilator. So there's a couple different things that tests that you can use to see if the patient is ready. And one would be basically to check the NIF, negative inspiratory force, to see if the patient could actually take a breath in without any support from the ventilator. Another thing would be just check the vital capacity, see if the patient can breathe enough, move enough air in and out to maintain their oxygenation ventilation needs first. And then, of course, an ABG. Just check what's going on in the patient's system, their pH, make sure they're ventilating, getting all their CO2 out and oxygenating, making sure they have enough O2 in their blood. So after we do a number of tests to see if the patient is ready, and we determine that the patient is ready, and basically we're going to gather our equipment that's going to help us in extubating the patient. So first, we need a couple things. First, we're going to need basically a syringe, because we're going to need to deflate the cuff. We're going to need a yonker, a suction device, because we're going to have to suction above the tube and suction probably a little bit after we take the tube out of the patient's airway. We need a towel to place on the patient's chest, because it's going to be a little bit of a messy procedure pulling the tube out of the esophagus. Trachea. Oops. And then we're going to get some kind of oxygen device to give the patient some supplemental oxygen after we extubate them, because they're going to still need a little bit of help. So then after we get all the supplies that we need, then we're going to maintain asepsis. We're going to make sure that we're clean, make sure that all of our equipment is sterile. Usually your equipment's packaged, but in this scenario, we just got to use what we got. Another important thing would be to check any kind of isolation precautions. You're going in there to extubate someone, you need to protect yourself. So you might need a gown, a mask, gloves, whatever it is that you're going to need per that isolation. So once we get everything ready and prepped, of course we're going to go back into the things that we know. We're going to go in, we're going to talk to the patient, we're going to check the patient's bracelet, make sure that the patient is who they are. At this point, maybe they probably won't be able to be verbal with you, but you can check the bracelet to get the date, the number, their name, just to identify the patient is who they are. And then after that, the patient's obviously going to be conscious at this time, so they're going to be able to hear you and nod and give you a little bit of idea if they're ready, if they understand you. So you're going to counsel them a little bit on what's going to happen. You're going to let them know, hey, we're going to get this tube out, and let them know what's to be expected, because obviously they have a tube in their airway that feels uncomfortable. When we're pulling it out, that's going to be another uncomfortable event. So the more we can talk to them about what's going on and prep them in this situation, the more they know what they feel what's going on, it's going to be a little bit easier for them. So basically we would identify ourselves, tell them what we're going to do, identify the patient, and coach them a little bit. So we would obviously at this point we need to sit the patient up in a semi-fallows position, but with the mannequin that we have, we can't really do that. So we want them to sit up, that way when we do extubate, nothing is going to get aspirated back into the lungs. Sitting in the proper position, we pull the tube, we can suction, and we can still protect the airway at that point. So we have the patient sitting up, we have everything on standby, we're ready. So at this point we're going to basically hyperoxygenate the patient a little bit. We're going to get them hyperoxygenated, because at that point when we pull the tube out, they're not going to be getting support. Maybe they're going to be coughing. It might take them a little time to settle down to get a normal rhythm back. So we're going to hyperoxygenate them. That buys us a little bit of time to keep them from crashing. So we would do that. Once we've already explained, sir, we're going to take the tube out. This is what we're going to do. So now we've hyperoxygenated the patient. We're ready to go. So what we'll do, we'll get our syringe ready so we can deflate our cuff. So we're going to get everything ready at this point. Obviously the ventilator would be hooked up still at this point. So what we would do is, we would suction around the top of the cuff. We would take our yonker. It's going to be a little uncomfortable, so make it quick. Suction on top so that way any fluid around the cuff when we deflate won't go down into the lungs. So we would suction. So now at this point we would ask the patient, take a deep breath. Once the patient takes a full deep breath, we'll turn the ventilator off, deflate the cuff, and we're going to come out with the tube. Boom. Now we tell the patient to cough. The patient's going to cough. We're going to ask them, hey, push everything forward that you feel in your airway, and they're going to feel that phlegm or just that fluid, and we're going to suction. So everything that came up with that tube, they're going to push up with them, and we'll get it right here in the airway. We'll suction everything out. We'll make sure that they're doing okay. At this point, we would take our oxygen device, and we would give them a little bit of supplemental oxygen, you know, just to get them over the hump. They were just intubated, the machine was controlling all their breathing and everything, so now they're taking control again, so they're going to need a little help. And usually we could either use a nasal cannula or a mask, but for right now we have this non-rebreather because that's what we have to use today. So we'll use that, but it's okay to use that, give them basically close to 100% just for a little while until everything settles down and evens out. At this point, we may, you know, explain to the patient not to talk too much because their airway will be a little bit inflamed, and that'll keep it from being more inflamed because we have to worry about stridor and other things because they just had a tube in their throat and that was pressing on the airway. So once we take that out and deflate, the airway could swell, we could have some complications. So it's very important right now to basically monitor the patient, listen to their breathing, listen to their chest, listen to you hear any kind of wheezing in the airway, and that'll identify maybe if we have to give some kind of racemic epinephrine treatment, cool mist treatment, or maybe we may even have to intubate again because the airway could swell up and shut. So those will be the basic steps that we would need. And so at this point, it would be okay to hyperoxygenate the patient again, just to get them back up to a good level where they feel comfortable. And then once we do that, we let them sit for a while, maybe an hour, and then we take another ABG, and then we reevaluate the process again, see if the patient's doing okay. The ABG is going to tell us if their body's able to maintain, you know, a nice homeostasis, or if maybe we need another form of ventilation, oxygenation, maybe we need some BiPAP, or a couple other things. So at this point, we would just evaluate the patient and see how they're doing extubated, and that would be our extubation process.